I don't know that I've really been spoken to about sexual health that much, if I'm being quite honest.
They generally ask you questions about how many people you're in bed with, or if you've ever come across an STI, or if you would like to get testing for it, or if you need resources like condoms or dental dams and things like that.
Yeah, I'm talking about my gynecologist. They don't ask me so much stuff about my sexual health. Sometimes maybe I feel some discomfort and I don't know how to tell her about that.
It seems to me as that I've gotten older, I really don't hear anything even approaching the general subject. It's pretty much staying on general health, but avoiding, sexual matters or sexuality.
No, I never had this sexual type of question in a routine visit.
No, I feel the same. It never happened to me that my general doctor asked me about my sexual health.
When you're like an adolescent and you're growing up, I think having conversations around perhaps contraceptive or making sure using very light conversation about protection and kind of the risks around unprotected sex, I feel like that could be helpful.
I think the topic of sexual pleasure is important to bring up to your healthcare provider because it's not something that's talked about in a public setting. So I think it's important to initiate that conversation so that the patient knows that it's something you can talk about.
I wish they asked if you experienced certain things after sex, certain itching, certain dryness, certain things like that where nobody likes to talk about it.
Maybe they could ask things like, can you define consent, or what does consent mean to you? Are you feeling safe in your sexual relationship?
Asking questions, open questions like, is there anything that you might be experiencing that you might have any concerns that you would like to discuss?
I think a healthcare provider should talk to people and ask them if they have the proper resources to protect themselves against sexually transmitted infections and diseases.
I think it's really important to talk about pleasure.
And when you're going to a general health, they avoid it. So it'd be nice if they included that and helped the person to just feel generally more comfortable to be able to speak about that, along with any other health concerns that they might have.
There is the stigma, so being conscientious of that and then trying to go the extra mile to alleviate any embarrassment, shame, whatever. I don't know, I really think that's the responsibility of the healthcare provider.
But if you come from a more supportive, nurturing standpoint, then someone will feel more inclined to open up about things, I think.
To Sarah's point, the cut and dryness, if you just treat it like a check yes or no and very dry, then I'm not going to feel comfortable to open up to you. We need to introduce a level of humanness in these rooms, conversations, relationships, yeah.